To recap Noordhoff's repair, a Millard lip repair is done without a back cut. This stops at the opposite philtral column. A small M flap is elevated. The lip skin is elevated as far as the philtral dimple. The medial crus of the lower lateral cartilage is released and the M flap sutured into the defect. As we prepare the lateral lip element, a turbinate flap is elevated based anteriorly, as is a lateral lip flap based on the ala. Scissor dissection is used approaching from the lateral side to separate the nasal skin from the depressed lower lateral cartilage, the septal angle, and the normal lower lateral cartilage. The turbinate flap is then rotated into the piriform aperture defect created by moving the alar base, as well as suturing the lateral lip skin together to close the piriform aperture. The bottom of this flap is sewn across to the septum to close the floor of the nose. The lateral lip skin is prepared, the C-flap is elevated, and the muscle under the alar base and the upper portion of the lip is sutured in. In this case, the C-flap is sutured into the floor of the nose. The vermilion Z-plasty is performed as described earlier, and the lip is closed. A suture is placed in the nasal tip to elevate it. A horizontal mattress suture is then placed through the columella to maintain this advancement of the medial crus. A suture is placed laterally to lateralize the vestibular web without the use of bolsters.